Judy is the Environmental Health Supervisor and Environmental Health Supervisor at the Tacoma Pierce County Health Department, which is easier to say if you say TPCHD. And we all, I, myself, and all of us here at the Mustard Seed Project got to know Judy over the course of the last year and a half or so during the pandemic, especially. TPCHD has really done, I think, an excellent job of helping support the peninsula community as we have navigated our way through the pandemic. And I'm just a couple of examples of the programs that
Where's the volume?
Did he mute us?
Could somebody ask Neil to mute himself, please? Thank you. But TPCHD has provided COVID kits, box filter fans this past summer to help with wildfire smoke during the pandemic, essential groceries, vaccination clinics. We just had one here the other day, at least 2 or 3 last year, and recently a mammography van too. So just really adjusting the work that they do, and we tried to support them as much as possible during this difficult time. So with that, I will let Judy take over, and she's just going to talk a little bit about the available services that the Tacoma Pierce County Health Department provides. So Judy, you're muted right now, but go ahead and take it away.
Thank you, Eric. Yeah, you guys have been phenomenal partners. In fact, lots of amazing partners out there on the Key Peninsula during this really tough couple of years we've had now. I think we're getting close to 2 years. So I really enjoy working with the Key Peninsula community. I think it's a really supportive community. You all do an amazing job of supporting each other. So Eric, can you let me know how much time I have and whether I should share anything on the screen or just talk a little bit?
Either way, if you'd like, Marion, could you give Judy host control? And usually, folks we've had speak, talk for about a half hour or a little longer if you want. We have a full hour.
Okay.
And then we just leave time at the end for questions.
Perfect. Thank you.
Yep.
Okay. I'll see if I can share a little PowerPoint that I put together, just because I know PowerPoint's not everybody's favorite and we're all a little zoomed out, but it helps me stay on track. So just to make sure I say all the things that I want to say. So I have been at the health department, excuse me, for 16 years. So doing air quality and healthy housing most of that time. Now I'll just have to, if I can't figure out how to advance my screen, then there we go. Just a little reminder, I work in the environmental health division. So our COVID response work, a lot of that is in your typical clinical care, what we think of as medical care and healthcare, vaccines and testing. But a good part of what makes us healthy comes from just social and environmental factors. So it's not all just affected by your medications or what the doctor can do for you, nor is it all affected just by your own personal health behaviors. There are things kind of that can be out of our personal control or feel that way sometimes that can affect 55% of our health. So my focus again, housing and air quality. I'll cover that in a little more detail, and then I'll share about give you kind of a snapshot view of a lot of other programs that are at the health department, and I want to leave lots of time for questions. So for several years, we had an asthma home visiting program. So we would go out and help folks with asthma, and then for a while with COPD to identify things in their home that could be making them sick, could be making their respiratory conditions worse. And those home visits stopped during COVID. And so we're just kind of waiting to see what the next steps will be. We don't currently have any funding for that, so I can't promise that it's coming back. But they were pretty successful. We had community health workers, and so this chart might be a little hard to see depending on what you're viewing it on, but the community health workers would talk about things like asthma triggers, allergens in the home. There could be mold or pests like cockroaches or rodents sneaking in, which can be allergy triggers, trips and fall hazards. And then we also had folks from the weatherization program doing some more structural building stuff. They would put in weatherization and air sealing and insulation, and make sure there were carbon monoxide detectors and repair leaky sinks and things like that. And it was really successful. The weatherization side of things is still happening. And so I want to make sure people are aware of that. So this is through Pierce County Weatherization. That's not a health department program, but I wanted to be sure and share it with you all. These are the income guidelines. So on the left there, for a household of one, this would be a gross monthly income of $2,646 to qualify. And then on the right, that's the home repair program. And people don't know about that. They have minor home repair and major home repair. Sometimes you can just get it covered. It's like a grant. Sometimes you get a loan, a 0 interest loan that is paid off when the house is sold, or it might be a low interest loan. So there's lots of assistance for homeowners who meet these guidelines. And I put the phone number on here as well. You can get energy assistance through Pierce County, even though you may have Peninsula Light and they have their own, I think it might be like a one-time energy assistance. They may have something more that I'm not familiar with, but you could potentially contact Peninsula Light and also Pierce County's energy assistance program. And I just want to encourage folks to do that if you fall in these income guidelines, because we have all watched you may think, oh, I don't need help with my utilities, but we've all seen what the cost of groceries have done, what the cost of gasoline has been doing. If you're renting, rents have really gone up. Property taxes may have gone up. So the assistance is there. There's more assistance right now because of COVID. The money is there. And so if you think you qualify, please consider applying for energy assistance and for weatherization, so that you can get your house weatherized to feel healthier and be healthier, and to also save on your utility bill. That is what the money is there for. This is just some feedback from the program. And this was when we were doing, again, the asthma home visits with the community health worker and the weatherization. This family, the grandfather there, he had asthma, but also the grandson that came and spent summers and after school with them. And so sometimes your house might be affecting not just you, right? If you care for a family member or people come to visit and they have asthma, there could also be concerns. And I'm going to talk a little bit about things you can do to make your house healthier. There might be some new ideas for you. So one of the biggest things that we talk to folks about is cleaning products. The cleaning product industry does an amazing job of marketing all of these things and making us think that we need all of these chemicals for better living and for cleaner homes. But they have a lot of negative health effects that, you know, if you read those warning labels, they're there for a reason. And like bleach, for example, even Windex will do this to me. It makes my eyes water. And if your nose is burning or it makes you cough or your eyes water, that's your body telling you this is not a good thing, right? So trust your body on those signals and try to avoid using these strong cleaning products. I will say that a lot of the seniors that we worked with actually were not as likely to be using most of these. Those old school ways of cleaning are healthier. Opening windows, using something simple like vinegar and water to clean your floors, using some baking soda and vinegar to clean out a sink. Those are much safer. There's you can find green cleaning recipes online, and really you just need some good soap, like a little bit of whatever dish soap you use on a rag, and you wipe stuff down, and that will break down most germs and viruses. Even COVID that will break it down. Now, obviously, if you have somebody in the home that's sick with, vomiting or diarrhea, then using a properly diluted bleach solution or a disinfectant is not a bad thing. But if you don't have somebody who's sick, really try to avoid these. They're really harmful to your lungs and other parts of your body. Pests and dust, I want to talk about a little bit. That's a cockroach on the right. He's a little blurry, but that's was from a home visit that I went on. We never used to see cockroaches when I started here 16 years ago. And then about maybe 7 or 8 years ago, we started to get complaints of them. And I don't know if it has to do with climate change or just with more people moving and coming and going in the communities, coming from other places. But I do see cockroaches now, and the thing to know about them is they have such short life cycles that they can adapt to whatever. If you're using, we recommend the baits and the gels. So don't spray anything. Don't use a bomb. Anything that you spray or use like a fogger, you're just going to get that all over your house and into your lungs and into your system. And if you have any little ones that come over and they're down on the floor touching things, it's incredibly harmful to them. So baits and gels are the trick for cockroaches. And if you continue to have a problem, you switch between the types you're using every couple months so that they can't develop a resistance to it. And then on the left, that's hard to tell what that is, but that's down in like a heat vent. It's a place we don't look, but if you have a furnace with the duct work and you have those vents in your floors, just pop the cover off and put your vacuum down there, your vacuum attachment, and clean out whatever you have going on down there. We just don't think to look in there. You can hang your arm down there with a cell phone and take a photo, and it will give you a picture of what's going on in your ductwork. You turn the flash on, and you'll get a sense of whether you really have a problem in there or not. This picture shows some mouse droppings, and that can be a sign that you have a rodent problem, obviously. So looking in there and taking a picture with a flashlight is a good trick. Companies will offer to come out and clean your ductwork. We don't recommend that necessarily unless you do see that you have like a rodent problem in there. We don't want them ever spraying disinfectant chemicals into your ductwork because that will just continue to be dispersed through your house every time you run your furnace. Moisture and mold, that's the biggest thing that we see folks having trouble with. The basics of using fans, exhaust fans, if you have them, opening a window if you don't, because that's how my old 1910 house is. We don't have an exhaust fan yet. We're going to get one put in, but we just open the bathroom window after the shower. That mold on the right is a pretty extreme example, but we do see a lot of that, usually in rental housing where landlords are not willing to make appropriate repairs. But back to the bleach conversation, folks want to spray the mold with bleach and make it go away. What we want you to do first is scrub it with soap. If you have, everybody should have masks around now. That's the good thing. N95 is best, but putting on some kind of mask so that you're not breathing in the mold spores, getting some soap and water and just really scrubbing it off of there. Because if you think about, if you spray a little bleach water on your shirt, it's going to make a white spot, but your shirt is still there. And it's the same thing with mold. If you just spray it, it might visually appear to have gone away and you might have killed it, but those dry, dead mold spores still cause health effects. So we need to physically remove it by scrubbing. And then once you've done as much scrubbing and removing of it as you can, then if you want to do a final step, again with a diluted bleach and a lot of ventilation, you can, but you don't have to. We don't actually recommend bleach for mold. If it gets really into the paint, especially on like a sheetrock, you really need to replace that section of sheetrock. We recommend, and the EPA recommends, going 2 feet beyond any visible mold because they send out little tentacles that you can't see. And so you really need to cut out 2 feet of sheetrock. And again, in my 1910 house, I spent several months without one bathroom wall this past summer because there was a mold problem inside one of the walls. And the amount that was visible on the outside of the wall was maybe like 2 square inches. But when we started cutting out part of the wall, we found that it was the entire wall had mold inside it. So what you see on the surface is often just a small sign. So those are the big housing concerns that I just wanted to talk about. And again, I'll try to have time for questions because there's all sorts of other things that can be concerns in our home. Then there's the things that are happening outside of us and that feel less in our control. And that is the climate changes that are happening. We're having more droughts, we're having hotter, longer summers, and longer wildfire seasons. That's another thing that I didn't even have to worry about until about 2015. So we had no wildfire smoke response program. We didn't have any educational materials about wildfires. We weren't paying attention during wildfire season, and it's, you know, completely different now. We are prepared. We have resource materials. We're planning ahead. We're connecting with folks around the region because the fire doesn't have to be, as we know, we've never had one here. We've had the Sumner grade fire, but we haven't had, you know, those huge forest fires affect us over here on this side of the state yet. But we get smoke from all around the region. And so being prepared for that is what I want to talk about next. Just a reminder, we got spared last year, but this was 2020, and you probably all remember weeks of really smoky air quality that is not healthy for any of us. This gives you, again, just a sense of what it has looked like over the last few years. The dark blue is the more recent, so you can see how much it's been changing. And then there's Pierce County that I've circled there in red. But another interesting thing on here is those bottom counties are, a lot of those are kind of down in the southwest. And so you can see that 2020 was the first year that they had to deal with wildfire smoke at that level. So it's really just becoming a bigger problem. Maybe not nationally, it's a bigger problem each year. We did get lucky this past year to not have it as severe as 2020. There's something called the Air Quality Index, and then the Washington Air Quality Advisory, similar system. If green is, you know, you're good to go. Yellow is moderate air quality. You need to start paying attention. And then orange is unhealthy for sensitive groups. And there, about 40% of our population in Washington state lands in that orange group. So it's a pretty big, large number of people that can be affected sooner by poor air quality. And the thing to keep in mind here is it's not just wildfire season, it's also wintertime when everybody's burning their wood stoves and using their fireplaces. So you may be experiencing some of that out there over the last month. I know that I smell wood smoke in my neighborhood sometimes, and I'm over here in Tacoma. So if you're following the air quality index, just again, pay attention to when it hits that orange, unhealthy for sensitive groups is really when I suggest people start taking precautions. If you're over 65, if you're a child, if you're a pregnant woman, if you have respiratory disease, heart disease, diabetes, or are a smoker or are overweight, those are all the groups that are more sensitive. So like I said, that's a lot of us. And this is just a reminder, in 2020, that was our worst year on record for Pierce County to date. So, oh, there's the list of folks who are more at risk, and just a little chart again that shows you as the air quality gets worse, the hospitalizations for respiratory problems increase. So that's just a snapshot from Washington State Department of Health looking at extra respiratory hospitalizations in 2020. Just a quick why kids are more vulnerable, and this is true for they're vulnerable to those indoor pollutants and allergens, as well as the outdoor pollution and contaminants. It's because for a couple of reasons. They're still developing, so all their systems are growing, and so they can be just impacted in different ways. They actually breathe more air per pound of body weight. So if you've ever watched like a little baby or a toddler breathing, they're breathing pretty fast, so they're getting more air in. If there's a pollutant in the air, they get more of it. And then they're also active. They're running around all the time. If you've ever, if you've got kids, but they're just moving all the time, which means they're breathing in more of it. And so it's hard to get them to just sit still and stay inside sometimes. Elderly folks are also more vulnerable. If you're over 65, things like, your airways and the little lining of the airways, it's not turning over as fast. It's not healing as fast if it has trouble. And so, and then I know that lots of seniors are very active too. I envy those folks who are retired and can, on a nice day, go out and go to the park, and you might be outside as well, working around on your property and doing things. And really paying attention to air quality is important. Trying to put off mowing the lawn or working in the garden on those days when the air quality is really poor. And that's my grandma Georgette in the picture on the right. So I just like to share her photo. So what we do at the health department, for those things that are more in your house, we have, although the Puget Sound Asthma Coalition, I shouldn't say that, that's a group, Pierce County, some folks from King County, Thurston, Kitsap. We have 2 meetings a month. One is for people who touch on asthma, COPD, healthy housing, and air quality through their work, through their professional life, or through their volunteering, or just really may just be a personal interest, but they want to get in a little deeper and talk about policy and talk about programs. And there's doctors, school nurses, health department folks, academic researchers, lots of folks meeting once a month. So if you're interested, my contact information is at the end. And then we have a second group that just started this year, and they meet on the second Thursday in the evening for an hour, and it's called the something like the Family Breathing Circle. I'm not remembering because it's brand new. And we have a facilitator who is well-versed in all of these topics, and she's a life coach by trade. And so she teaches us about personal things that we can do. And so this month, like December, is focused on stress reduction. And in November, it was on getting ready for the holidays in a way that doesn't trigger asthma attacks and respiratory problems. And again, that's open to anybody, meeting virtually through Zoom. And that's an evening meeting. And we have teenagers, because the Asthma Coalition has teen advisors that have worked with us for years. So we have them, their parents, we have parents of young children, we have seniors, a range of people. Like I said, we're not doing home visits right now. That might come back. We do try to offer education like this. We can give presentations and provide materials and resources. We can also do a little bit around lead poisoning prevention. It's another unfunded area of work right now. We take a lot of phone calls with people who have healthy housing concerns in their rental housing, and we can do some advising there, and then we do some policy work. For instance, there's no rental habitability code in Pierce County, and so that's something we would like to see put in place, so that 10 by 10 foot wall of mold is actually a code violation rather than just handled as a standard rental concern. When it's a wildfire smoke incident or really poor air quality just from a weather inversion in the winter and lots of wood burning, Then we do that regional state coordination. We might send out health advisories to schools and doctors' offices and do social media posting. We have some air quality monitoring equipment and we're getting more. And the Clean Air Agency also has some. And then Eric mentioned the box fans and HEPA filters, and I'll show you a picture of those here in a minute. So that's my personal HEPA filter pre and post 2020 wildfire season. So the one on the right was at the end of summer, and then that's a new clean one on the left. So they really work well. It's if you have a furnace, you can also upgrade your filter in your furnace. You need to check with a HVAC company to make sure you're not going to make your furnace work too hard, but it's the perfect one that stops both wildfire smoke, wood smoke, and also reduces any COVID-19 or viruses floating around is called a MERV 13. So it's they have ratings, and so be MERV and then the number 13. But again, if you're going to put that in a furnace, you want to check with the furnace company and make sure that that's okay to do in your furnace. Air sealing, that's, you know, putting caulking and weather stripping and things around so that the smoke can't come in your house as easily. And then we suggest you identify one room in your home that we call it the clean room that you have. Then you just stay in there and keep doors and windows shut and run either a HEPA filter or a box fan filter. And then I suggest taking snacks and water and puzzles because that's what I would like to have. But whatever will keep you happy and entertained in your room, you should have that kind of ready to go. This is what the box fan filter looks like. We've got a bungee cord holding it on. You can use tape, you can use brackets, but you just need your standard 20-inch box fan and a MERV 13 furnace filter. And you attach it, and you can see on this chart, it's just a wonderful visual of how well it cleans the air inside a home. So that red line, at the moment they turn the fan on, it just starts removing the particulates from the air so rapidly. And you only have to run it for maybe 30 to 60 minutes, depending on the size of your space and how well sealed your house is. And then you can turn it off, and as long as you're not opening doors and windows, the air will stay clean for 8 hours. So it's a great tool to have, and you can do this for $35 versus, you know, paying a couple $100 for a HEPA air cleaner. We want you to be ready, both, again, winter wood smoke season and also wildfire season. If you do have respiratory conditions, please check in with your doctor and ask how you should adjust them if the air quality does reach unhealthy for sensitive individuals. What do you need to do? Again, the N95 masks are the one that will protect you from smoke. KN95s probably do. We just haven't tested them as well in the US. Your cloth masks do not protect you from smoke, nor do the surgical ones. And then checking expiration dates. If any of you have mild intermittent asthma, you know that the albuterol can sit there for months and you don't need it. So make sure that it's not expired when you do need it. So you want to periodically check on that. And you also need to spray it a couple times. They call it priming the medication if you haven't used it for even a couple days. So, sorry, a little pop up there. I'm almost done, I promise. This is how you can sign up to watch your air quality. You can, for wildfire notifications, you can just text this 313131. You text the word wildfires to that. There's a website for Puget Sound Clean Air Agency, and you can sign up to get email reminders, or you can just go there and look at this visual. Thumbs up means you're fine to go outside, and if it's a thumbs down on, you know, jogging, then that's not the day to be physically active. If it's thumbs down on the picture of the person sitting inside, then that's the day you need to have that clean room, right? And really be doing what you can, because that means the air quality is bad enough to get in your house. Whole long list of potential programs. and websites that our website, sorry, links to our website. But just again, this is to remind me to mention these programs to you, and just to encourage you to go to tpchd.org and see what we have. There's a lot of information, just some snapshots. There's information on mold, all those things I said about how to clean it and not clean it, how to prevent it. There's a place where you can let somebody know if you have an outdoor air quality complaint. Maybe you have a neighbor who insists on burning their garbage all the time, and you yourself have asthma and that's really harming you, or you know, they're not burning clean wood and you're getting a lot of smoke. We will send out a notice to them, just letting them know that their burning is affecting a neighbor. We don't identify the neighbor. Sometimes they know if you've had verbal conversations with them. And remind them that if the Clean Air Agency comes out to do an investigation, then they can end up being fined for not burning appropriately. So it's sort of a gentle reminder before the regulatory agency gets involved. There's information on natural yard care, on septic systems, which I know that's what's going on out on the KP. There's all of our COVID-19 information, where to find testing and vaccine clinics, how to talk about opioid use disorder. There's information if you have somebody that you care about that needs and wants to get treatment for opioid disorder or for any kind of substance use disorder. We have information on the website, information on mental health and behavioral health resources. There's a food safety inspection rating, so you can check out your favorite restaurants and see how they did on their latest food inspection. So that's just a pretty quick snapshot. There's a lot of different things that maybe people don't know we have here at the health department. And then that's my contact information. Then I want to have time for questions now.
Thank you, Judy. Oh, are there any questions from anybody on Zoom who is here? You're free to turn your screen on, ask a question. Apparently, Judy, I'm going to let you know there was a technical difficulty.
Oh, I see that in the chat. Shoot.
It actually went to Marion Sharp, our development director's personal feed instead of our mustard seed project feeds.
Oh.
The challenges of technology. So yeah. What we'll do is post the recording as soon as we're able to Facebook. So I'm sorry.
Okay.
Does anyone in the Zoom chat room or have any questions for Judy on your excellent report? Okay, Mary says, I'm concerned about nearly homeless people on the Key Peninsula. What's being done? Yeah,
it's a great question, Mary. And we have 2 new positions here at the health department. So there is a community coalition. You might know the name, Eric, because I'm going to mess it up. But there is a Gig Harbor Key Peninsula Community Coalition that focuses on homelessness.
Yes.
And we haven't had a health department representative attending that. And that's going to change with these new positions. Jenny Sheppy, who's been working with a lot of the communities on the COVID clinics, and she has been supporting COVID vaccine clinics and testing out at homeless shelters and encampments over here in Tacoma. So she's knowledgeable about that community, some of the barriers, although we also know that barriers and assistance that is happening in Tacoma is very different than barriers and assistance available on the Key Peninsula. So she will be in learning mode. She'll be joining that community coalition and learning what are those things that folks on the Key Peninsula are facing and what kind of solutions might we try to support. The actual Pierce County Human Services is the lead agency for homelessness and housing concerns in Pierce County. But we try to support them and we try to step in with the understanding that housing is health. And if you don't have housing, it's really, really difficult to be healthy. And people often develop things like substance use disorder and mental health conditions as a result of first becoming homeless. A lot of times people think it's the opposite, and there are probably some scenarios where it is. But what studies have found is more often than not, it is the homelessness that happens first, and then those other things follow. And so Jenny will be joining that group, and then Adam Reichenberger is our housing policy position that started about 5 months ago. And he's been, again, focused over here on home in Tacoma. You guys maybe haven't heard of it, but it's a big thing happening over here to try to increase housing density in Tacoma, because we don't have enough homes anywhere in the county. And that causes the ripple effect of prices countywide down into Thurston. And then people who are at the lower end of affordability get pushed out. And so that is, he is focused on housing policy. So next up, he's started working with the county, and we'll be talking about that. But again, we need to learn. So he needs to learn, what are the barriers on Key Peninsula? Do you need some multi-unit housing? Is that even allowed? Does the community want it? You know, what does the community need and want? What's going on? So that's what we need to learn. Because you know, I'm honest that we don't know. And the Key Peninsula is one of the health department's communities of focus. We have 6 of them around the county, and I'm the lead for that community of focus work. So if you know, Mary, of a meeting that we need to be at, or a conversation that we need to have with a person, please do connect me, because that's an area that we need to start figuring out how we can help the Key Peninsula. So thank you for asking that.
That's great that you're recognizing, you know, via the, you know, the more people working on it, the magnitude of the problem is, I mean, of course, it's not a new problem, but it's certainly not it's gotten much worse during the pandemic.
Yeah.
And you know, of course, it's an obvious fact, but it is, what you said there really rings a chord. I mean, you cannot be healthy if you're homeless.
You know, I think about it for myself. I think how impossible that would be. And, you know, if you had a chronic health condition, whether it was high blood pressure or asthma or any of that, how hard is it to get your medications and stay on your medications? And then just the exposure to the elements and the mental health impacts. Yeah, it's pretty hard. And I know one of the things I did learn from Lisa Larson, who was at the KP office there, the KP Council's office for, I think she's with Safe Streets now, but people who are homeless on the Key Peninsula, particularly if they're from the Key Peninsula or that more rural area, even, you know, up into Kitsap, the shelter services in Tacoma are not generally perceived to be the right fit. So the person who's experiencing homelessness, the thought of being put over here at one of these large shelters in Tacoma, drop down into the middle of a city that they don't know, with unfamiliar places and people and crowds, is just that's not the right fit. So they might prefer to stay out on the Key Peninsula in their tent, and I can understand that. You know, I don't blame them. And so we need to think about it from that perspective. What kind of services can be created on the Key Peninsula to serve your own residents who are finding themselves unhoused?
And to your question about multifamily housing, I think the only multifamily housing is right next to building a small apartment building, and that's it.
That's it. Yeah.
And then we're building for seniors the housing across the road, but that's it. Any other questions from the Zoom group here? Well, thank you. Oh, there's one. Just a quick follow-up. I live on Heron Island, and we get skipped all the time, Mary, which I imagine that is the case. Some people don't even know you're out there.
Yeah, it's a fair point, Mary. And so again, as the Key Peninsula community of focus lead, let's connect, and I can at least get a better understanding of Heron Island. I don't know a lot about it. Maybe I should even come visit.
There's a thing coming up on Memorial Day weekend that Mary has been talking to me about, a community gathering they have every Memorial Day weekend. So yes, we should talk about that.
Okay, yeah, yeah, let's connect about that. That would be great.
Anything else from anybody? Otherwise, I'll let you go, Judy. Thank you so much. That was a lot of information.
I know, I feel like I sort of information dumped on everybody. So again, the website has it all. And just go visit and see what we have. There's a lot going on. So
Great. Thank you for all the good work you do.